Hi, I'm Dr. Joe Nyamtu, LoveThatFace.com, and welcome to the Aesthetic Show 2019. I don't know if you can hear or see the chatter, but we are in the belly of the main exhibit hall, and it's a great day here in Las Vegas, Nevada. It's about 110 degrees, and not only is it hot outside, but we've got some hot guests here that are going to tell you about the hottest things in cosmetic surgery. Today, my guest is a longtime friend, Lori Robertson, RN, who is a very well-known injector. And if you, in education, if you do much with injectables, fillers and Botox and the related treatments, you know her name. And I've learned a lot of valuable injection tips from nurses, and Lori's just wonderful. So welcome.
Thank you.
To the show.
Thank you, Joe. Thank you.
And so a couple things. Now, Lori, you just opened a new office?
I did. I just opened a new office in Southern California, North Orange County in Brea. And beyond blessed, it's been open for about 8 months and I'm booked out a month. So just hired more staff on, and it's amazing. I feel like Cinderella. It's been wonderful.
I mean, it's a lot of work to open a new office, for sure. It's expensive, and it's sometimes a risky venture, but I think for most doctors, there's nothing more rewarding than to, have a new office. Now, you have something unique in that you have a teaching center, right?
Yes,
so
I do.
Tell us about that.
My partner and I, Dr. Gideon Kwok, who is my partner in the business in Southern California, we started, my office is big, it's about 4,300 square feet. So I have plenty of room for us to kind of learn and grow, and a couple of my big back rooms have actual room for me to have 20 or so people in it for injectable training. So I have about a large room that we can have all didactic with tables and chairs. I have cameras on the ceiling. I've got TVs on the walls. So we have classes in that didactic room that are fundamental classes, and people don't realize that you need the fundamentals. You need to know anatomy. You need to know the rheology of fillers. You need to know how the face ages. So we have a whole day invested in just the fundamentals of injections and anatomy and rheology. And then the second day in the other room, we have 4 beds, and we have no more than 4 people around each bed. And they will be with one instructor, and it's very intimate, very close, and very good hands-on training on the second day. So we have fundamentals classes that are the 2 days. We have a cadaver course with John. Next one coming up is with Dr. Jonathan Sykes, amazing anatomist.
Yeah, John's a good guy.
And we have advanced workshops that are actually going to be under eyes, temples, jawline fillers, things like that are advanced workshops. So we have a lot of things coming up. People have asked for cannula courses. We're going to do sculptural courses. So it's called the aestheticimmersion.com, and we book up kind of quickly, but it's beyond blessed to have it in Southern California and to be 15 minutes from Disneyland, and people can hang out. And I have an Embassy Suites across my parking lot, so it's perfect.
That's
perfect.
Awesome. Now slow down and tell us again. It's called what?
It's called the aestheticimmersion.com, or the Aesthetic Immersion is our school, and we have a web-based, and you can sign up on the web to do different things and to actually sign up and ask about classes. We can communicate with you on the website.
So one of the things I think that Lori talks about is safety, and fillers and injectables are by and large a pretty easy procedure, but like anything else, to be really good at it, you have to be skillful and you have to be safe. And I've seen pictures of your setup and your training center, and I mean it's pretty neat. So let's move on a little bit and let's talk about what services do you offer within the walls there.
Right. Everything injectable. Basically I have lasers and injectables, so all of the dermal fillers, the toxins, different laser procedures, CO2s, radiofrequency tightening, resurfacing, microneedling, PRP, all that good stuff the non-invasive, basically, right, that we offer. So there's a lot of fun stuff that we can do within the realm of being non-invasive and help people with concerns that they have, which is what we want to do.
Sure. So Lori, I think that it's interesting that, so like what I do, facelifts and eyelid surgery and that sort of stuff, it's on a more aging population. What you do a lot of is a lot on a younger or millennial population. So Tell us a little bit about how do you get those patients in the door? How do they find you and that sort of thing?
That's a great question. The demographics have changed tremendously. Years ago, I would get, like we had the baby boomers and our Gen X's, but we would get people that would come in and like refer a friend. So that friend would come in and do a consult with us, and we would have to win over that friend and learn, teach them about ourselves, and really let them know who we are, how we interact, how we assess them, that we're honest, that we're forthright. So it would take a while in the consult to do that. I have seen such a paradigm shift now with social media, and especially millennials who are very social media savvy. They will follow me on social media, and they will come in and they know me, they know what I'm thinking, they know the dangers, they know the good stuff, they know how it works, they know how fast it breaks down. They know, these millennials are smart, they have researched everything, they don't want to take risks, they like to be dealt with very honestly. They're smart kids. This is a smart group. Sure. So they come in with knowledge already, and it's almost like they know me. Yeah. So we skip that part of the consult, and I love to teach and explain, sure. And they will actually kind of say, no, it's okay, just do it. I've seen it. You can just do it. I'm like, no, I just need to explain this to you. Right. So it's a whole different paradigm shift that I'm seeing with the more social media savvy patient.
So when millennials come in, and as we talk about, everything's on their phone. Now, I just gave a lecture a couple minutes ago before this interview about managing patient expectations, and sometimes, especially for surgical patients, it makes me a little nervous when somebody comes in and says, "Here's 80 selfies of me. Here's how I want to look. Here's a couple celebrities." What do you think about that?
And
how do you manage that?
Yeah, and they're all
filtered, right.
And you're like, everybody wants to look like their filtered face. So it's tough, and we really have to set those realistic expectations. I totally agree with you. Sure. That's so important, or we're going to have an unhappy patient. Yeah. So we really have to tell them, first of all, if they're millennials, do they need it? Do they need it, or are they being overcritical of themselves? So we have to be really careful and be very honest with them in what we recommend, because we're healthcare providers first, and we are in retail medicine. Yeah. So we have to be very honest and not cross that ethical line, and be very honest with them. Sometimes they get overcritical, and I tell them, "You look great. Please don't do anything yet." Sometimes I say, "Yes."
And that's important. Yes. And that's an honest doctor, because a lot of people won't do that.
And I think that's so important. I think if anything, that they trust us more. Yeah. They will come back to me when I say that, and they'll beg me, like, "Can I do my filler yet? Please, can I do it?" And I'll go, "Okay, just one." So they beg me to do that sometimes, because I want to keep them looking like them. I don't want them to look like somebody else. I want them to just look like them, just arrested them. Right. Not a done them. Right.
So we have about 2 minutes left here. I want to ask you a couple questions. Number one, what is your most common combination of treatments? I mean, like, do a good percentage of your clients or your patients come in and have this and that at the same time?
Probably my clinic mirrors a lot of clinics across the country, and Botox or toxins and fillers are probably the most common. Right. By far, that's the majority of what we do. So it could be alone or in combination. Generally, toxins are the gateway drug, but I am seeing the millennials in my office, fillers are the gateway drug. So still statistically, toxins are, but we're seeing a big climb in fillers, and it's the lip thing. It's the whole Kardashian effect, and people are very aware of it. And the younger crowd doesn't mind sharing what they've done on social media, because they grew up with this.
And that's
so it's not taboo anymore. It's okay to share this.
Right. All right. And now we have about 1 minute, and I'm going to ask you a question. And I like to ask this to injectors. What is your favorite area to inject, and what do you think are the nuances of doing that in that area?
Well, that's tough. Probably my favorite area to inject are lips. Okay. I love doing lips. I love finding new ways to do lips, new products. Different products react differently. Finding what that patient wants, what do they want as an endpoint, and me getting there with the product that I choose. It's so important that we know the rheology of the product and how it interacts in tissue to be able to choose the right product for that patient. And I find that there's a lack of knowledge in rheology among injectors sometimes, and that concerns me. You don't just pick something up because. You have to
Yeah.
look at how it interacts in tissue, and so to fill that patient's expectations. So I love doing lips. It's pretty. It makes somebody just look younger and more vibrant. Sometimes just balancing things back out.
Very good. So my favorite nurse injector in the whole wide world, Dr. Lori Robertson from Brea, California. And again, if you're in this profession, you know about her. Thank you so
Thank
much
you.
for spending
Good to see
time
you.
with us, and go get them.
Thank you.
All
Thank
right.
you.